Assalamu alaikum viewers, this is Dr. Khawaja Sajid Aslam. I'm one of the orthopedic surgeons. Today the public awareness program what we are doing is about diabetic foot. Actually we have done plenty of programs about this topic, but this problem is so common in the community all over the world, not specifically in underdeveloped countries, but all over the world. It's so common problem that it needs more and more awareness about the people about this disease, so people can bring to the patient early to hospital and get treated and live a healthy long life. First of all, the myth for the diabetes is people correlate each and everything with diabetes. Once you get the diabetes, people believe that anything happened to them, even if they get abdominal pain, they believe that this is because of diabetes mellitus. It's not true. Not every disease, every sickness is related to diabetes mellitus. Of course, there are certain problems which are associated with that. The important thing which needs to keep in mind is diabetes is one of the most common disease in all over the world. And diabetes does nothing to the person unless it is controlled. Once it's uncontrolled, of course it involves all the systems of the body, including the cardiovascular system, skin, everything, bones, everything, every system it involves. So most important thing is to keep your diabetes under control. That is the single most important thing in diabetes. Getting back to our topic for the diabetic foot. Diabetic foot happens in diabetic patients who get the wound on their feet. Why it's common? The wound is, majority of patient wound is only in the feet, not in the hands or other parts of the body. Reason is people who have diabetes, specifically who have uncontrolled diabetes, and over 10 years of period, they start to get the neuropathy. Once they get the neuropathy, their sensations of feeling from the feet and the tips of the fingers start diminishing. It comes proximally from feet to the ankle, to the leg, to the knee. It comes proximally. So once their sensations are lost, they don't feel or feel less. They ignore the trauma, micro trauma. I mean anything puncture or any tight shoes or any small injury, they ignore it. And they notice only once it's already advanced, one is already a deep wound. So that is one of the main reasons why problem is mainly on the feet. And feet are one of those things is majority of people they neglect. Majority of us, we don't even look at our feet to see our heel or interdigital space or nails or tip of the toes. We don't look at them, I mean, as often as we look at our hands. So that's another problem as well which leads to diabetic feet. Another important thing in treatment for the diabetic foot is choose the best doctor. In your opinion, if you think that doctor is the good one who can treat this infection, because diabetic foot is not ordinary infection, it's not an infection which you get on the skin or after the operation, it's entirely a different thing. So first of all, choose the good doctor, the best doctor, which in your belief, in your point of view, that this doctor can treat and has been treating such kind of problems. Choose that doctor, not general practitioner or not any other doctor who is just treating flu and cough and typhoid. Second thing which important for the patient or attendants is the patience. Because once you get the diabetic foot, the wound, first of all, it takes always long time to get it treated, always. Second thing, of course, if it's a long treatment, is expensive. Third thing is a long stay in hospital sometimes. So all these things are frustrating for the patient, for the family, and for the doctor as well. Because patients and attendants keep on bothering to a doctor, oh yeah, it's already 1 week now, it's not getting better. So these are the important things which you have to keep in mind, doctors and the patient and attendants, that these three things are important. It's a long-term treatment. So if you need to have patience for that, because diabetic foot wound is not going to be healed completely within a day, within a week. No, it may take a month. So you have to have patience. You have to keep money for that because it's expensive treatment, and you have to have proper follow-up. Don't ignore the precaution which has been given to you by doctor. As I said in the beginning of the program, that the most important thing in the treatment for diabetic foot is to control the diabetes. It's not that you keep on taking antibiotics and dressing every day, but you don't control your diabetes. Recently, I did amputation of one of the patient who was diabetic. He came from abroad. He was diabetic, hypertensive, his leg amputated below the knee, and that stump becomes infected and very foul smelling and necrotic. Then he went into septicemia, and then they shifted him to Pakistan. And on the same day I did above knee amputation, and I just have seen a week ago, after a week of operation, just I have seen him yesterday. So stump is completely healed, is very well conditioned. All I would say is that he started to control his diabetes. That's the most important factor in infection controlling or in the wound healing. So be patient. Have patience when you get treated for the diabetic foot. Take care of yourself and your family. If you have any question or you want to contact me, on display is my contact number. Thank you.